Morning, everyone. We're going to give you a brief about basically one of the revolutionary moments that's happening in the entire world and one of the pivotal happenings that's evolving in this part of continent in India as well. So let me begin with the lifestyle medicine, a primer. It's just an overview of the entire lifestyle medicine scenario and evolution and what exactly lifestyle medicine stands for. And I would be trying to be as precise as possible. So first of all, the disclaimer, whatever is being showcased is not exactly a recommendation or an endorsement. So the objectives of the talk is basically to elucidate the current burden of the non-communicable diseases and the need for lifestyle medicine. Let's understand the basic concepts, briefly explain the pillars, wherein how we can connect into the existing mainstream medicine, and highlight the studies that have brought a deeper understanding of lifestyle medicine, and of course, introduce the Indian Society of Lifestyle Medicine to the world. So what is lifestyle medicine? As there have been a number of definitions coming from different organizations, but one of the definitions that was coined by one of the doctors, his name is James Rippey, and he mentioned that it's a rapidly evolving field that addresses the lifestyle-related contributions to non-communicable diseases. But as preventive medicine specialists, and I would say as public health specialists, we do understand it involves the concepts of behavior change. So these behavior changes can be at the population level, I would say at group level, or even in the clinical settings at the individual level. So there's a connect, basically health promotion, a behavioral change component, and integrating it with the conventional medicine. Over here, we are not talking about that, let's leave medicines and all. No, we are sticking to the existing mainstream medicine. And with that, we need to give more importance also to lifestyle modifications through behavioral changes. And of course, for that purpose, we require health promotion. So this entire concept wherein the lifestyle medicine fits in is basically bridges this gap. Wherever there's a disconnect between these components, lifestyle medicine comes into play. Now, there are some more definitions that have come. Basically, it's entirely an evidence-based practice. Earlier, we used to come across, I would say, lifestyle modifications as advices coming from even physicians, practitioners. Now then, they were not put that smartly in a measurable way. Wherein if you would, in terms of, if I quote, for example, a physical activity, it would be more of that you need to increase your physical activity. Maybe you need to do some exercise, you need to control oil and all that. Those are, I would say, more generic advices. In lifestyle medicine, we work in form of prescriptions, smart prescriptions. As for example, the medicines are prescribed. We are looking forward to prescribing physical activity and nutrition over here. So that's why we call it evidence-based practice. And it's entirely dependent on evidence-based literature and not exactly simply on experience-based management, and basically helping out individuals, as I said, and also communities with comprehensive lifestyle changes, and which will obviously involve the concepts of population health, public health at the health promotional level. So there are certain pillars that are of importance over here, as for example, the nutrition, the physical activity, even the stress management, the social support, the connectedness. Now, we in today's world do understand there is a disconnect in between the social connectedness, although there is a lot of networking happening on social media and all, but there is a gap and there is a void in form of social in-person support and connectedness. And obviously the environmental exposures with rapidly evolving issues regarding climate change and others. Over here, we are trying to address that as well. So in all these comprehensive components, what we come across is basically how to prevent, treat, and even reverse the progression of chronic diseases by addressing the underlying causes. So we're hitting the root cause of the diseases and not more of the palliative or symptomatic treatments over here. So if we look towards some more precise definitions, it's basically an evolving medical specialty in different countries where it has kind of reached to a certain extent where we may call it a specialty that uses intensive therapeutic lifestyle interventions as a primary modality, in addition to the existing medical modalities of treatment, drugs, and whatever is required in terms of procedural interventions as well. For chronic conditions, as we know, regarding cardiovascular diseases, type 2 diabetes, obesity, and we are now including in this particular spectrum the other functional or lifestyle disorders, for example, GERD, and other I would say musculoskeletal issues, which also need ergonomic interventions in terms of lifestyle modifications. So I'll not get into the detailed definitions again. So let's now move to the global lifestyle. The non-communicable diseases, they kill around 41 million people each year, and this keeps on upgrading. And the last we've come across is some updates that each year 17 million people die from NCD before the age of 70, and so on. We have some statistics quoting with regard to different lower income and middle income countries. But the main point that I need to put over here is this: that we do recognize that there's a huge burden of non-communicable diseases. And of course, this proportion is keeping on increasing because of the different lifestyle that we are adopting, more of at the population level, more of the determining based on the commercial determinants of health, and furthermore, whatever is happening and has been evolving in I would say, the urbanization and ultra modernization. Now, for example, tobacco use, physical activity, inactivity issues, use of some addictive substances, and all the unhealthy diets all increase the risk of dying from NCDs. So this we can appreciate from these many figures that, yes, of course, NCDs are the leading cause of deaths causing in globally, even according to World Bank economics and statistics. As per the income classifications, we can appreciate there is a considerable burden in almost all the countries. And if we say that there is relatively higher in the higher income or other regions. So the point is, nobody is kind of left out of all these dynamics of evolving non-communicable diseases. And that's why we have had number of policies, number of, I would say, public health interventions, but we need to have some innovative solutions even now to hit it at the root cause. Because of course we are dealing with management of diseases, but what about the root cause? Where do we nip it in the very bud and start reducing the increase or the incidence for the incidence as well as prevalence of non-communicable diseases? Now, 80% of healthcare visits, hospitalizations are mostly due to chronic diseases, out of which these particular diseases form the major chunk. How do we deal with this alarming situation? And let me tell you very frankly, this will keep on increasing. It's not going anywhere because we are getting into more of these super specialized interventions, I would say tertiary care level interventions, where we are looking forward to the numbers, the tests, the golden hour treatments, the thrombolysis and all those things, maybe how to make insulin available and others. Yes, of course, those are very important things as well. But how to deal with this situation where behavioral change and the behavioral change economics comes into place? And how do we deal with those kind of determinants of health that are not going anywhere? Because as we say it in preventive medicine, we have left the tap open and the bucket is already filled up and it's spilling over. How do we deal with this situation? So let's come to the Indian context. Now, NCDs have become a top killers, and we have a good chunk, like in the diabetes side, India being called the diabetic capital of the world. Now, the estimated annual deaths of NCDs is there, and it's keeping on increasing. We have had wonderful interventions coming from the government, and with the inclusion of NAFLD and then the transient schemic events also in the NP and CD. There have been wonderful initiatives being taken. And I would say, let's also think how to include the behavioral changes in the primary interventions. So obviously all the public health specialists stand for. So there we need to see how we can re-strategize and maybe pitch in some new kind of modifications wherein we are hitting again the root cause of the disease. So around in the 2021, we had around 537 million people, adults, with regard to this. Now, again, if you see the progression happening in specifically with regard to the diabetes report, there is an increase, that the burden is increasing and immensely increasing. We need to address it, and in whatever innovative solutions we can have with the existing ones at the treatment as well, but obviously at the promotional, primary, secondary, and tertiary prevention levels as well. Again, we have this data from the Comprehensive National Nutrition with regard to the non-communicable disease risks. This survey was targeted at children and adolescents. We can again see the shift happening. If you see in the adolescents, we have higher prevalence of total cholesterol. And similarly, we can appreciate the fact like prevalence of low HDL during in the adolescent age group. Now, these are vulnerable populations which are exposed to such kind of lifestyle, which makes them easily, I would say, susceptible to these kind of non-communicable diseases later in life. And with all the things that are happening, I'll keep on reckoning and iterating the same word, the commercial determinants. Those need to be addressed on the population level and very intensely at the individual levels or even at the group levels, or whichever means of, I would say, interventions we can devise. And for that purpose, obviously, we require some robust literature research, or maybe even conducting those kind of research, or setting up those kind of evidences which will have innovative solutions to interventions at all these levels. So again, if we appreciate in all these figures, which have come from the Ministry of Health and Family Welfare, that there is a prevalence of hypertension among men, and which is around like earlier data, and it keeps on increasing. It's increasing, and we need to address it. Yes, we're having wonderful initiatives, but there is something still that needs to be addressed, and that's basically closing that tap. How do we close it? Let's have it at the health promotional level. Let's have it at the primary prevention and the secondary prevention and deal with it. And one of the important pillars is basically physical activity. We do understand that, like in today's world, with everyone glued to their laptops and all the devices, where we have the privileges to get our things done at the snap of time and get it done everywhere in terms of in the sedentary lifestyle where we are stuck up. We need to address, we need to develop, strategize those kind of policies where we promote physical activity, even in the offices, even in hospitals, even in any part of the country where we are concerned that there is minimal amount of physical activity, there is exposure and availability of those kind of foodstuffs which are not, I would say, that required for the body. It depends on the calorie dynamics. How do we consume it? So on those parameters of glycemic index and all, we need to reconsider what is made available to people, what is made easily accessible as compared to those things that should be there. So as I said, it's an evidence-based medicine, and it has its roots entirely in science. It draws from research in various disciplines like epigenetics. We have microbiomes, psychology, dealing with the stress component, the nutrition, and the exercise physiology. Now, there have been important research studies in lifestyle medicine. Whatever we are deliberating upon is entirely based on evidence, published evidence in good reputed journals with high impact factors. Now, diabetes remission in clinical trial, I can quote one of them. Then intensive lifestyle changes for reversal in coronary heart disease. And there's a list of important research studies in lifestyle medicine. Well, some of them are there. And if somebody's interested more of this, we have a resource bank of all of these, which would be helpful to kind of devise more detailed, I would say, programs, which would help to alleviate these conditions in the very beginning of life. Now, how do we differentiate between the conventional and the lifestyle medicine? We had thoughts of these modifications, the changes in the conventional form as well, but they were dealing with individuals' risk factors. Or here, we are dealing with lifestyle causes, the goal of primary, secondary, and tertiary. Here, patient is an active partner, and we are looking forward to that role being played by the patient over here as themselves. It may not necessarily be a patient, it may be a beneficiary as well, who's looking forward to promote their healthy lifestyle, even before the development of, I would say, the risk factors. Now, we are totally standing for the fact that medication obviously is required, but lifestyle medicine or lifestyle change has also to be incorporated. So responsibility falls mostly on the beneficiary or the patient. Emphasis on motivation and adherence. And how do we re-strategize that? How do we come into an interaction? How do we basically keep on the follow-ups, like we have follow-ups in the simple inpatient or outpatient clinical visits? Lifestyle medicine also works in the same modality, in the smart manner. So over there in the conventional form, the stress, because of various conditions or various circumstances in different parts of the world. And I would say, for example, in those regions where we have high population dynamics, or rather a high proportion of population and a more non-communicable disease burden, or various other factors where the patient-doctor ratio or the doctor-population ratio, depending on lots of things, how far a doctor can dedicate that time in an OPD to the lifestyle modification component. That also needs to be addressed. There are a number of other factors, just to give you an idea how LM is different from conventional medicine. So these 6 pillars, which basically are I would say, the foundation stones of lifestyle medicine. And those components have been already there. And it's not something that's entirely new, but yes, we are getting into the intensified therapeutic lifestyle modifications. So nutrition is one important component. Stress management is another important component. Social connectedness. And I reiterate the fact that it's not simply social networking digitally, it's in-person social networks, which have a better influence on the psyche of people as compared to just staying and gluing to your devices. Restorative sleep. We're talking about the sleep hygiene, the physical activity component that needs to be addressed at all levels, even if people are healthier in their current homeostasis. But this needs to be dealt accordingly so that we have, I would say, programs, we have a work culture, we have something of that sort in our schools. All these components needs to go to that particular level, that it's inducted in our lifestyle through educational curriculums even, and avoiding risky substances, which have I would say, are of concern in today's world. And the next generation coming in would be more susceptible to these kind of issues because of the transition that we have observed since our childhood and we entering the adulthood. It's going to go escalate and I would say accelerate in a different direction in coming time. We need to address this, and we need to do it now. So with regard to the nutrition component in lifestyle medicine, the LM practitioners predominantly suggest that obviously it's basically the whole food component that should be promoted more, and predominantly the plant-based diet. Okay, with whole vegetables, fruits, beans, lentils, which we are already aware of. And of course, minimizing the use of animal products. We're not saying completely just shy away from this thing or take sides. We are suggesting please reduce the processed food stuff consumption. Use your whole foods in a very best form. And it's not exactly the raw form, but as far this chain of processing increases, there are different concerns with the food product that is being provided at the consumer level. That needs to be taken care of. Then let's talk about physical activity. Again, I stand in recommendations with regard to the minimal amount of physical activity. This needs to be taken at both at the healthy population level as well as the next level, that is prevention of the diseases or slowing down the progression of the diseases. This again needs to be dealt very strongly as far as we can develop, I would say, a research-based evidence which promotes exactly all these 6 pillars. They've done well in I would say US and UK. They have good amount of evidence, and from the Indian context we also have. There's no doubt. But let's get into more specific how all these things are interconnected and how far they can give I would say those eye-opening results in healthy as well as diseased population. Now, sleep deprivation with different lifestyle that we are coming across these days, this is one of the major concerns which people are rarely aware of, like gluing down to their laptops. Everybody is sleeping these days with their mobile phones in their hand, and most of them fall asleep with their mobile phones and others in hand, or a tab and all. This needs to be taken care of because once it's inducted in your lifestyle, over a period of time, you may not see a change within months, or maybe you may not be appreciating that change. That change might be already over there. So it has, this sleep deprivation has their impacts on all the systems, immune, dermatologic, muscular, nervous, and all of those. So sleep around 7 to 9 hours or 6 to 8 hours that's what's required for healthy life. We need to look into generation of evidence for this particular pillar as well. Stress management, physical activity, mindfulness, and meditation can make individuals more resilient and reduce stress. And this particular concept or this particular pillar is one of the prime concerns that we have these days. And this will keep on increasing with the evolving world, the stress component, and how to deal with this situation. We need to generate evidence, I would say, on this. So there is some good amount of work done in the West in terms by Phillips and others. And in fact, Beth Freites, who's currently the president of American College of Lifestyle Medicine as well. So there's remarkable work done in these. Then again, avoiding risky substance use and includes tobacco, drugs, and alcohol. So these 6 pillars form the major foundation stones of, I would say, lifestyle medicine. And this is where we all stand for, that these needs to be addressed in terms of dealing with chronic diseases. Social connectedness, as I said, even the American Heart Association mentions like loneliness increases the risk of heart attack. Being socially connected helps, and all details, they have been already there. Just to give you an idea that these 6 components are of how relevant they are. Now, how does this LM, I would say, skill-based component work? Now, what does a lifestyle medicine professional or a physician do? So we have different array, or this is more about the teamwork rather than an individual bringing in behavioral change. A lifestyle medicine physician is basically trained to take comprehensive and detailed assessment of their patient, which I'm afraid, like the other specialties, they also are appreciable in the fact that they do the similar kind of a thing. But we are looking more of into the lifestyle component. So there's a thorough assessment with regard to the nutritional profile, physical activities, sleep levels, stress, and other parameters. Then the practitioners are versed with the fundamentals of behavior change and use approaches such as motivational interviewing, health coaching, and positive psychology to bring in these particular changes. By assessing in which level of behavioral change they are, then what kind of customized prescriptions lifestyle medicine prescription should be issued to them. Depending on that science-related dynamics, such kind of prescriptions, as I said, the smart way, the acronym is being used over here, the specific, measurable, accordingly the time relevant, and the others. So in the clinical settings, as we have talked about the public health concept, the population level, the group level, and we're talking about the clinical settings. So it starts with a comprehensive lifestyle behavioral assessment. There's a team of specialists, there's a doctor, there's a coach, there's a behavioral specialist, a nutritionist, and an exercise specialist or a physiologist. This forms a lifestyle medicine team. And one of the most powerful aspects of LM is that patient becomes more engaged, active participants in their own self-care, disease prevention, management, and overall well-being. So there are barriers that and issues that we have come across, and the people who are practicing LM, like any other specialty, they also do come across. It depends on the compliance, the background, the socioeconomic class, I would say the motivational level or the behavioral change level, wherever the beneficiary or the patient is. So the behavioral modification components, as I said, the readiness for change coming from the other end, the stages in wherever they are, like the pre-contemplation, contemplation, preparation, action, maintenance. And then, of course, at times we have relapse, and at times, most of the times, we do come across a relapse kind of a situation. So what are some of the vital signs on which lifestyle medicine is based on, like the anthropometry and all the other indices, the diet, the physical activity? We have scales to monitor that, and fortunately, with the technological boom, we have devices to measure that, which are kind of available at almost every level to some extent now. And obviously, as the technological evolution keeps on continuing, we'll have more accessibility to such kind of things. Sleep patterns, again, data-driven approach with devices that we have, because lifestyle medicine is not that is something practiced only in a clinic. So it's practiced outside the clinic as well. And whatever is happening every day, every moment that a patient or a beneficiary is coming across is basically your data-driven approach of lifestyle medicine. Emotional well-being and stress, then the substance abuse. And those are some components which are easily, I would say, quantified in terms of through already existing mainstream components. And we are working in collaboration with psychologists, psychiatrists to deal with such kind of situations. So in the nutritional interventions, we have extensive scientific evidence, which has been already there. And as I said, it's with more regard to the whole food and predominantly plant-based endorsements in what kind of consumption of food should be preferred. Then under-consumed food, nutrients of vegetables, antioxidants, others, which form the main component of these kind of prescriptions. Over-consumed food processed or processed foods, those need to be avoided. So again, the nutrition prescription is put up in a smart way. Like, for example, we say it's the type of food, the amount of food, and the frequency of food. That's the way how this prescription, a nutrition prescription, is being prescribed over here. Now, healthy eating behavior, mindful eating, what to eat, when to eat, what not to eat. Now, I've just given an idea about this already. For example, let's give an idea about what would be a smart goal and what will not be a smart goal. So if I will increase my fruit and vegetable serving to 3 per day starting from tomorrow, so that's kind of a more refining that particular advice. If I will decrease my intake of any particular soft drink and all, that also needs to be taken care of. So similarly, refining it to that level where it becomes more quantified. Sleep management, with respect to sleep management, sleeping less than 6 to 8 hours a night increase the risk of early death by approximately 12%. Now, we can understand now with today's lifestyle, whatever is fluctuating in our sleep cycle these days, how far we are getting exposed to those kind of stress levels and unhygienic sleep profiles, which is kind of affecting subconsciously all our physiological parameters, which includes cardiometabolics, neuropsychiatric, and obviously all these interconnections between all the systems. So we need to kind of lay stress on that. Again, regarding stress management, it leads to anxiety, depression, cardiovascular disease, irritable bowel syndrome, and other dysfunctions. We need to focus on these particular parameters. Social connection, in terms of unhealthy social relationships, we have associated with increased mortality and morbidity. A doctor, coach, and a psychologist on board in an LM team is always helpful in alleviating and, I would say, addressing these concerns. And if at all it requires a referral to a psychiatrist, even, we also work in that particular modus operandi. And this has been already talked about with regard to the addictive substances. And we do have at times referrals going towards the addiction medicine specialists. because this opens another Pandora's box, which needs to be addressed. But if I say more towards the primary care setting, this is one of the major concerns that even LM specialists have come across at various instances for development of non-communicable diseases. So what do LM practitioners do differently over here? So the expert approach versus a coach approach. As I said, the patient is the main focus of attention and it's patient driven. It works on the curiosity, the openness of discussions, how to come up with a solution or to all these issues, appreciation for any particular step taken by the beneficiary in a compassionate manner. And let's be honest towards each other, both from the healthcare practitioner side as well as from the beneficiaries end. Now, let me give you a brief about with respect to the Indian Society of Lifestyle Medicine. So ISLM came into existence and its thoughts basically, I would say, came into existence in 2017 in Manila when they were having a conference, second international conference of Asian Society of Lifestyle Medicine, where basically people from India, some Indian allopathic physicians came into grouping and they thought, let's have this society in India as well. And it was registered as a not-for-profit in 2019. And the mission goes as that's with respect to the transformative culture of health and well-being for humanity by utilizing the principles of lifestyle medicine. Now, we only do not stand for basically a treatment part, but we also looking forward to that the prevention, management, and whenever possible, reverse the lifestyle-related diseases like diabetes, obesity, hypertension, metabolic, and this list keeps on increasing. So what does Indian Society of Lifestyle Medicine do over here? It promotes lifestyle medicine practice by conducting lots of initiatives and events like education. There are monthly webinars for physicians, educational lectures for physicians preparing for board certification by the International Board of Lifestyle Medicine. We're conducting annual conferences and workshops to upgrade the skills and make people aware, even the healthcare practitioners with this. And we are collaborating in conducting research. There are journal clubs happening. There are research-related discussions. And we have taken some good amount of, I would say, projects in terms of conducting research as well. And then sharing good practices in the clinical services component, formulating clinical guidelines related to lifestyle medicine, and obviously recommending it to certain organizations which can adopt it in a way that it becomes more of substantive in the existing mainstream medicine. Now, how do I become part of this community of Indian Society of Lifestyle Medicine? These are some details, and we have our social media pages. If somebody just wants to connect and see what is happening in the Lifestyle Medicine Connect in Indian side as well. So these are the ones, some benefits have been listed over there with regard to becoming a member of Indian Society of Lifestyle Medicine. And with all this connect, whatever is happening in the lifestyle medicine, the ISLM, we are looking forward to call to action basically with regard to ensuring healthy lives and promoting well-being for all at all stages. And obviously for the sustainable development goals at 2020, we are looking forward to reduce by 1/3 this premature mortality from non-communicable diseases. And let's connect, let's collaborate and make it possible that we're able to achieve and make this world a better place to survive and to live in. It's incumbent, obviously, upon the health professionals, not only for treating illness, but attacking the root cause of the disease. We need to focus on the preventive health, promoting health and wellness. So lifestyle medicine basically gives us this opportunity. And obviously, any particular organization would love to collaborate in that manner that they are able to reduce a big burden, a high burden of diseases on mankind. And I would conclude this particular talk with this quote that medicine is not only science, it's also an art. It does not consist of compounding pills and plasters. It deals with the very process of life, which must be understood before they may be guided. Thank you.
Thank you. Thank you, Dr. Rabbanie. Fantastic, very thought-provoking presentation. And the concluding slide is even further intriguing. What have we actually done to our practice of medicine? We have taken it entirely to a pharma prescription. This is something that should have been much early appreciated. Like the earlier we appreciate the 6 steps. I just reflected on myself. I'm getting everything wrong. Like all the 6, I'm defaulting on all the 6 fronts here. So very, very motivating as well. So thank you for taking out time for talking to us, orienting us to lifestyle medicine.